Greetings and welcome to the Bone Marrow Stem Cell Transplant Caregiving Common Concerns Throughout Transplant webinar. At this time, all participants are in a listen-only mode. If you have not already done so, please close all of the programs on your computer. You may submit a question via the web at any time by using the Ask a Question feature on the left side of your screen. If anyone should require operator or technical assistance during the conference, please press *0 on your telephone keypad. It is now my pleasure to introduce your host, Jennifer Gillette. Thank you. Please begin.
Thank you, Roya and Incom, for helping us coordinate this program. And welcome to all attending our Week 1 of the Caregiver webinar series. I am Jennifer Gillette, Staff Social Worker at the National Bone Marrow Transplant Link, and we would like to thank you all for joining us this evening. Tonight's topic was designed to help caregivers cope with common concerns throughout transplants. Before we hear from our speaker, we would like to take a moment to make sure everyone is aware of our services. The National Bone Marrow Transplant Link is celebrating 25 years of dedicated service this year in helping individuals and their families from diagnosis through survivorship. We work with hospitals, cancer centers, and other organizations to reinforce and complement medical care by providing resources, support, and education. We are here to help, and below you will see a couple different ways that you can reach out if you are interested in our services. We would also like to thank our sponsors who made this event possible. A special thanks to Be the Match, Leukemia and Lymphoma Society, Santa Fe Genzyme Oncology, Insight Corporation, our dedicated board member John Kosman, and our esteemed Link partners. This slide that you're seeing now gives you a glimpse of the many resources we have available at the Link, including our many award-winning books and our DVD called The New Norm, which will guide patients and caregivers through all phases of the bone marrow stem cell transplant journey. I would like to point out also in this slide the Caregiver book, which is a favorite of many of our cancer centers. Please reach out to us if you are interested in receiving any of these resources. In addition to these great books, we have several other ways we support people on a transplant journey. We have our chronic graft versus host disease telephone series and webinar support program, our Caregiver webinar series, which you are a part of this evening, our peer support mentor program for patients and caregivers, Second Birthdays recognition program, and we provide other materials and referrals to our callers. The bottom line is we are here to support you. Without further ado, I would like to introduce to you our speaker for this evening. Olivia Houston has a Master of Social Work degree and is a licensed independent clinical social worker. She has been with the National Marrow Donor Program, Be the Match, since 2015. She is a BMT social worker and provides counseling services to patients in need of a hematopoietic cell transplant, as well as caregivers and family members impacted by the transplant process. Olivia facilitates support groups for transplant survivors and bone marrow transplant caregivers. Additionally, Olivia provides consultation for the development of patient education programs and resources related to psychosocial health. Olivia is an active member of both the Association of Oncology Social Workers and the National Association of Social Workers. Thank you, Olivia, for partnering with us on this series, and we are so honored to have you presenting this evening.
Whoops. Thank you so much, Jennifer, and good evening, everyone. It's my pleasure to be with you all tonight to talk about the caregiver role and common concerns caregivers may have as they navigate the transplant journey. By the end of the webinar this evening, you'll be able to discuss common caregiver concerns and challenges throughout transplant, identify personal signs or symptoms of caregiver stress, apply one new self-care strategy to reduce stress, and finally, list educational programs and resources available to support BMT caregivers. A cancer diagnosis is a major life stressor, often referred to as a game changer. The impact of cancer is experienced in every dimension of life and can tax one's existing coping skills and resources, both emotional and financial. Cancer has a far-reaching ripple effect on marriages, families, groups of friends, and in some cases, entire communities. BMT brings its own unique challenges in addition to the cancer impact I just mentioned. Transplant is a particularly intense treatment that necessitates prolonged absences from work and family or home life responsibilities. The recovery period is long, and patients experience significant short-term, long-term, and late effects. The caregiver is particularly important in the context of BMT, and I'll talk more about the specifics of the BMT caregiver role in my next few slides. In essence, the caregiver keeps things going while the transplant patient is consumed with treatment. He or she is charged with taking care of quote-unquote everything else while the patient focuses on getting well. Why are BMT caregivers so important? Well, caregivers are integral to the transplant process for patients. They support patients before, during, and after transplant. They help patients track medications, get to medical appointments, follow their doctor's recommendations, and cope with treatment. Research shows that the caregiver role is not only important in the obvious ways, but also reduces mortality in survivors of BMT. That's to say that patients with care tend to live longer. Caregivers are critical to the health, adjustment, and quality of life of the transplant patient. Caregivers have unique challenges, and their burden increases at the time of the patient's discharge. Before I move on with my presentation, I'd really like to highlight the importance of the BMT caregiver. You are absolutely essential to the transplant process, and you improve outcomes for patients. Caregivers are often under-acknowledged, so I want to recognize all of you now and say thank you for all that you do or will do for your patient. The transplant would literally not be possible without you. Who is a BMT caregiver? A caregiver is a family member or friend who participates in the 24/7 care required after transplant. For transplants where there is a donor, these are called allogeneic or allo transplants. The patient's transplant center usually requires a 24/7 caregiver for 100 days after the transplant. For many patients, the need for care lessens around the 100-day mark. However, some patients do continue to require a caregiver longer than 100 days depending on their medical needs. While your loved one is in the hospital, the nursing staff will provide the care 24/7. Your responsibilities will really begin after your patient is discharged home. The exception to this is for children going through transplant. Most pediatric centers want a family member with the child at all times in the hospital. Also, sometimes transplants are done on an outpatient basis, which means that the patient doesn't have a hospital stay. In these cases, caregiver responsibilities begin immediately after the transplant. The caregiver helps with hands-on medical care and emotional support needs. Depending on the situation, the caregiver may also attend to financial needs. Caregivers have many concerns about how to navigate and manage the needs of their loved one. This is normal. BMT caregivers experience stress directly and indirectly during their experience of caregiving. Because other family members and friends are often focused on the health and recovery of the transplant patient, caregivers may experience difficulty expressing their feelings or talking about their challenges with caregiving. Without enough emotional support, caregivers may feel isolated in their role. Changes in family and/or interpersonal roles can also make caregiving that much harder. Caregivers are faced with the challenges of providing a significant amount of care and treatment in the outpatient setting after the patient is discharged. Caregivers may feel unprepared despite receiving caregiving information and instruction from the treatment team prior to the patient's discharge. Caregivers are sometimes referred to as the forgotten survivors of transplant. Caregivers experience such a range of emotions during the experience. Caregiving dominates your life, cancels your short-term and long-term plans, and can cause resentment and guilt. Caregivers are survivors too. Now that I've taken some time to acknowledge the real challenges with which BMT caregivers are faced, let's talk more about the caregiver role pertaining to the medical needs of the patient. Some tasks that relate to your loved one's medical needs are done before, during, and after transplant. One really helpful practice is to use a notebook to track treatments, medication changes, and symptoms or side effects that your patient may be experiencing. You can also use the notebook to keep track of medical team members' names and roles, important phone numbers, and questions that arise. Some of my caregivers that I work with ask why it's helpful to track these things. There are a couple reasons why I like this suggestion. First, a notebook can help you conserve mental energy. If you write down questions and other relevant information along the way, you free yourself from having to remember the question or what was discussed in your last visit with the doctor. Second, caregivers share that it can be beneficial to have a log to refer back to in order to track their patient's progress across days, weeks, and even months. Progress in post-transplant recovery isn't always stable, and sometimes it can be hard to see the overall picture of progress. A log can highlight gains a patient has made that might be hard to see otherwise. As caregiver, another important role you'll have is to attend appointments and ask questions. You'll want to have an understanding of the treatment options as well as the risks, benefits, and goals of each option. You'll want to keep track of test results and the medications your patient is taking. Your patient will have specific medical needs after discharge. The medical team will teach you what you need to do at home to care for your loved one. Care at home will vary based on your loved one's specific medical needs at the time of their discharge. The medical team will teach you to monitor any symptoms your patient may experience, such as fever or rash, and they'll also instruct you on who to contact with questions both during and outside of business hours. If your patient leaves the hospital with a central line, the medical team will teach you how to care for it at home. Managing medications is an important task for caregivers. Patients are usually taking many pills at the same time, and their medication schedule may change often. Medications can be daunting. Keeping track of the medication schedule and any changes to that schedule is crucial. The clinic will print off a medication schedule for you, but sometimes it's easier to read and understand your own notes that you might have taken when meeting with the doctor. Communicate with your patient's medical team when there is a problem, such as fever, bleeding, rash, severe nausea or vomiting, diarrhea, uncontrolled pain, or changes in mental status. Other tasks you might expect as a caregiver include acting as patient advocate and serving as an involved member of the care team along with the patient, as well as assisting with nutritional needs, including possible intravenous nutrition. What are your other responsibilities? Well, other medical needs include arranging or providing transportation to the clinic. Sometimes transportation is needed on short notice. For example, if your loved one spikes a fever and needs to go to the clinic immediately. Cooking and cleaning are activities that patients need to avoid for infection prevention reasons, as well as the fact that they're likely going to be too fatigued to take care of these normal responsibilities. Caregiving for children and pets falls primarily on the caregiver as well. The patient is still a parent, of course, but they need to avoid some specific aspects of caring for children, such as transporting them around, providing care if they're sick, and other things for which they might not have adequate energy and stamina. Cleaning up after pets is also something to avoid for infection risk reasons. Let's move on to emotional needs. There are many ways you can support your patient's emotional needs during the transplant process. It's valuable to simply spend quality time together. It can be easy to get consumed by all the medical stuff that's going on and lose sight of connecting beyond the caregiver and patient roles. Simply being there for your loved one and listening to their thoughts, fears, and concerns is really important. For families who have a child going through transplant, it's important for the parent who is primarily at the hospital to spend time with the well children too. Creating a schedule where the parents can switch off or bring in another close family member to be in the hospital can give the caregiving parent a break and more time to spend with the other children. Another thing you can do to support your patient is to monitor for any changes in their mood. You are the closest person to them and will likely be the first to notice depressed mood or increased anxiety. The BMT team will want to know about mood and will also work with the patient to support them with any changes in this area. In the pediatric setting, the Child Family Life Specialist can help support you and your child in coping emotionally with hospitalization. For both pediatric and adult patients, the BMT social worker is an excellent resource to help you assess and address any mood-related concerns through the transplant process. Lastly, I want to touch on communication with other family members and friends. For caregivers, this can be a source of joy, stress, and often both. The most important thing you can do to manage this aspect of caregiving is to work together with your patient to come up with a plan. Who will communicate updates to whom and in what way? The answers to these questions will depend on your support system and preferences. It can be helpful to set expectations with family and friends around communication. For example, instead of taking calls from 5 concerned family members, it may make more sense to appoint one family member as your main contact and give them the responsibility of updating others via phone, text, or websites like CaringBridge and Lots of Helping Hands. These are excellent resources, and I've listed them at the end of my presentation. Emotional support and hands-on care are 2 main parts of the caregiver role. Depending on your situation, some financial needs may also fall to you as the caregiver. This slide lists 4 examples of tasks that a caregiver can help with. First, learn what insurance will cover. Your key allies for learning what insurance will cover are the insurance case manager and transplant center financial case manager. The Transplant Center Financial Case Manager will work with your insurance company to ensure that transplant is covered. However, there still may be some out-of-pocket medical costs, such as copays. The case manager can help you understand what these costs are. For those of you who need to relocate in order to be closer to your center, the out-of-pocket expenses associated with a move can be significant. You as the caregiver can help plan for how to cover these expenses. Some private insurance companies offer reimbursement benefits for meals, transportation, and lodging costs. If the patient has private insurance, you'll want to call the insurance company to see if they offer this with your plan. Keeping insurance and other benefits active is also incredibly important. If the patient carries insurance for themselves and/or their family, the caregiver may need to work with the patient and employer to make sure that insurance continues through COBRA if and when that's needed. Also, the caregiver can help make sure any paperwork is completed for any short-term or long-term disability benefits available through the patient's employer. For many people, transplant is a time where household income decreases and expenses increase. Financial resources may be available to you depending on the specifics of your situation. The Transplant Center social worker can help you find and apply for grants and other resources. If you're not yet connected to a transplant center, our Be the Match patient navigators, as well as AAMDS's information specialists, can help you get started. I'll review those resources later on in my presentation. By this point in the presentation, you may feel overwhelmed, or you may be wondering, is this all on me? Most often, one person, usually a spouse or parent, is the main caregiver. Sometimes a group of people share the caregiver role. This arrangement can work, but handoffs can get tricky when there are a number of caregivers. It's a good idea for the main caregiver to have a backup so that they can take a break, or in case they get sick. No one can do all the caregiving alone. It's crucial to get support from others. This support can take many forms. It may be emotional support for you, emotional support for your loved one, support with practical or logistical needs like meal preparation, cleaning, transportation to a clinic visit, mowing the lawn, etc. Some caregivers feel uncomfortable asking for help, and that's normal too. Here are some ideas to help you engage others' support. First, remember that people really want to help. They want to do something. Consider if the situation were reversed. If you'd happily help a friend, know that they'll also be happy to help you. Some people need specific directions, not general suggestions, about ways they can help. For example, I need you to watch the kids from noon to 5 tomorrow, or give them a grocery list and ask them to drop off the groceries on Tuesday afternoon, or you might give them a list of freezer meals you'd like prepared. It's helpful to be prepared with a list of options so that when someone offers to help you, you have something to turn to. Sometimes our minds go blank in the moment, and having a to-do list written down can help. Second, let go of non-essential things. You won't be able to do everything you used to do before taking on the role of caregiver. Accepting this and letting go of the desire to continue with all prior activities and tasks will help you refocus on what's most important at any given time. Be willing to relinquish some control. Delegating is one thing, trying to control every aspect of care is another. People will less likely help you if you micromanage, give orders, or insist on doing things your own way. What is caregiver stress or fatigue? Many of you may have come into contact with these terms, and they can be ambiguous and confusing. The demands of caregiving can feel overwhelming, especially if you feel in over your head or if you have little control over the situation. If the stress of caregiving is left unchecked, it can compromise your health, your relationships, your mood, eventually leading to burnout. If you don't get the emotional and physical support that you really need as a caregiver, stress can leave you vulnerable to a range of problems. What are some signs and symptoms that you might be experiencing caregiver stress, fatigue, or burnout? Here are some examples. You might experience anxiety, depression, or irritability. You might feel tired or run down. You might have decreased energy or difficulty sleeping. You might overreact to minor issues that never seemed to bother you in the past. You may develop new or worsening health conditions. You might have trouble concentrating or have feelings of resentment towards others. You might begin to drink, smoke, or eat more. You might neglect responsibilities or your own needs by cutting back on leisure or social activities. You might have trouble relaxing even when help is available to you. You might have feelings of helplessness or hopelessness, and you might experience increased impatience or irritability with the person that you're caring for. It's important to check in with yourself often as you care for your patient. Take note of your emotional experiences. Journaling can be a great way to chronicle this time, as well as to keep a watchful eye on signs and symptoms that you might be burnt out. If you're interested in learning more about the emotional impact of caregiver fatigue and burnout, as well as how to manage these emotions, tune in to the third installment in this webinar series on October 10th. How can I feel more empowered, you might ask? Feeling powerless is one of the main contributors of burnout and depression in caregivers. No matter the situation, you aren't powerless, especially not when it comes to your state of mind. If you're pre-transplant, now is a good time to explore what works for you and put some self-care habits in place. If you're in the midst of transplant and life is in complete upheaval, practicing self-care even for a few minutes a day can help to ground you and nourish you when you're pouring out so much day in and day out. If you're post-transplant, it's never too late to start some practices that help sustain you over the long run. The first way I like to help caregivers feel more empowered is to tell them to embrace their caregiving choice. Acknowledge that despite any resentments or burdens they might feel, they've made a conscious choice to provide care to a loved one. I ask them to focus on the positive reasons behind their caregiving choice. Perhaps they provided care to repay their parent for the care they gave them growing up. Or maybe it's because of their values or the example they want to set for their children. Or perhaps they've stepped into a role that no one else would fill. These deep, meaningful motivations can help sustain caregivers through difficult times. Second is focus on what you can control. Rather than stressing out over things you can't control, focus on the way you're choosing to react to problems. Third is celebrate the small victories. If you start to feel discouraged, remind yourself that all of your efforts matter in this transplant journey. You don't have to have the cure to your loved one's illness to make a difference. Don't underestimate the importance of making your loved one feel more safe, more comfortable, and more loved. Fourth is applaud your own efforts. If you're not getting external validation from friends, family members, or even the patient, which is more common than you might think, find ways to acknowledge and reward yourself. Remind yourself of all the good you're doing, and if you need something more concrete, try making a list of all the ways your caregiving is making a positive difference. Refer back to it when you start to feel low. And finally, talk to a supportive family member or friend. Positive reinforcement doesn't have to come from the person you're caring for. When you're feeling underappreciated, turn to friends and family members who will listen to you and acknowledge your efforts. I'd like to now take a couple of moments to call attention to Be the Match and the Patient Support Center at Be the Match. The Patient Support Center offers a variety of resources for transplant patients, caregivers, and family members. Our Caregivers and Parent Caregivers Companion programs are intended to support the specific needs of transplant caregivers. We have chapters from our Caregiving Handbook available online regardless of your enrollment in the program. The program itself provides the book and some other items to promote your self-care, and most importantly includes support from one of our BMT navigators who will check in with you via phone to see how you're doing. We also have a BMT clinical social worker who provides counseling to patients, caregivers, and family members affected by the transplant process. Survivorship chats are monthly telephone-based groups that focus on various topics that are relevant in bone marrow transplant survivorship. If you have questions about clinical trials or need help exploring your options, we have a nurse on staff who can assist you with needs you may have in this area. Lastly, here are some additional resources that I really enjoy. AAMDS, or the Aplastic Anemia and MDS International Foundation, BMT InfoNet, and NBMT Link are transplant-focused organizations that offer helpful support resources. Many people find CaringBridge and Lots of Helping Hands useful for managing communication to their support system. And finally, the Be the Match patient navigators are also available during regular business hours for any resource information needs you may have. If you have any interest in these resources, please contact us by telephone or email. And with that, in the time remaining, I'd like to address the questions that have come in from our participants this evening.
Okay. Thank you, Olivia. That was an informative and helpful presentation. Yes, we would like to start now the question and answer portion of this evening's presentation. We will start with some of the questions we received during registration and then to attempt to get to many from our live audience as well. I would also like to just give a short medical disclaimer and remind you that the information presented in this workshop is provided for your general information only. It's not intended as medical advice and should not be relied upon as a substitute for consultations with qualified health professionals who are aware of your specific situation. We encourage you to take information and questions back to your individual healthcare provider as a way of creating a dialogue and partnership about your cancer and treatment. But that being said, Olivia, one of the questions we received was, how do I keep others from meddling and stressing out the patient?
Thanks, Jennifer. That's a really great question and one that comes up for many caregivers that I've worked with and have met with over the years. I think when people know of a loved one who's ill, they really mean well and they want to help. They want to be supportive, they want to be in the know, prepared, and available. However, they really aren't living the patient and caregiver experience, and so they don't always come from a place of understanding that the patient's in recovery and the emotional stress of having to communicate with friends and family should be minimized. And this is often frustrating for caregivers to experience. I like to tell caregivers to really arrange for 1 or 2 channels of communication. So I tell them to appoint 1 or 2 trusted family members to be the quote-unquote communicators of all important health updates. So have the patient provide these family members with an email or call list of people that they want to keep in the loop. And if others go straight to the patient or caregiver can feel free to redirect them and let them know that they've appointed communicators who can share updates with them if they want to find out more about how the patient's doing. As I mentioned in my presentation, I know that many patients and caregivers also like websites like CaringBridge and Lots of Helping Hands. These are free websites. They're amazing. I love them myself, that enable patients, caregivers, or family members to communicate, share updates, receive encouragement, and organize help if they need it. It can really be a huge energy saver to centralize information on one of these sites that reaches a large audience of well-meaning people who love the patient. And then finally, I wanted to just touch on the meddling portion of this question. You know, if someone is truly meddling or providing, unhelpful, unsolicited advice, you as the caregiver should really feel the right to express that you see this person is trying to help, but that you and other family members are working together with the medical team to make the right caregiving decisions that protect the patient's health and well-being. You do have a right to advocate for yourself and the patient if someone is offering unsolicited advice that feels like meddling or feels as though it's stressing out the patient. So that's my answer to that one, Jennifer.
Thank you, Olivia. Another writer asks, what can I expect with going home from the hospital?
You know, I think that is a really tough question to answer in a short amount of time. But I think the best thing to remember is that the transplant center and the nurses and staff there will do a good job of explaining what to expect at home. So to expect managing medications, caring for a central line if there is one, as well as taking over the household responsibilities of cleaning and caring for kids and pets, as well as really just providing emotional support to the patient, which I mentioned earlier. The caregiver during this time is is really burdened with a lot of responsibility, and I think the mistake that caregivers make is feeling as though they're alone in this process. And I think the biggest thing to remember is that no one, even the most capable caregiver, can do everything alone. I think the best outcomes are when caregivers feel like they can patch together a patchwork of friends and family members who can be backup or come provide relief when the caregiver really needs it. And as I mentioned in my presentation, self-care is really important in this process. I think caregivers often feel too stretched to even take a moment to themselves, do something that makes them feel good, read a chapter in a book, watch a 30-minute documentary or game show on TV that you enjoy. Really get back to the basics of what makes you happy within reason and within what's possible in your caregiving experience at any given time. But I think it's really important to remember that you will receive education on what you need to do to prepare your home for the patient returning home, as well as what you need to do to manage medications and other expectations of the caregiver.
Okay, thank you. Another writer asks, how do I prepare for the adverse effects?
That's another great question. I think it can be impossible, really, to predict adverse effects or late effects of transplant just because every patient's case is so very different. Transplant is an incredibly difficult treatment, and the reality is that almost all patients have hurdles and need to cope with side effects. I think part of the preparation process is really coming to terms with uncertainty and knowing that there will be bumps in the road, so how do we prepare? I like to tell my caregivers that there's really no template for a normal recovery, but knowledge is their power, and so the more they know ahead of time about what to expect during your patient's recovery, the better prepared they are to take on the post-transplant complications as they arise. Some transplant centers offer caregiver classes that can help caregivers understand what to expect. And as I mentioned in a previous question, the nurses and the transplant center coordinators can be wonderful resources for information regarding recovery and possible complications. And they'll also know your patient the best. They'll know what to potentially expect for this patient's case, and they'll be able to inform you accordingly. I think it's also really important to remember that even after the patient is discharged and you're actively caregiving for them in the home, your nurses, the transplant center coordinators, and social workers that you may have met when your patient was in the hospital, they're still available to you by phone or by appointment. As the primary caregiver, you might also wonder, what your most important responsibilities are, and I think one of the most important responsibilities you'll have is to observe any physical changes in your loved one. It's really important to report any changes that you notice, no matter how small they may be. I think no report is too small or should be taken lightly. The medical team also really appreciates these updates, and they really rely on caregivers to be their eyes and ears when the patient is discharged home and is no longer in the hospital. And before I finish my response, I guess I also want to say that it's really useful to have 1 or 2 point people you can rely on for backup support if you need to arrange for childcare or other assistance in a pinch. Sometimes you will need to transport the patient to the clinic really quickly, and things need to be organized in a really expedient way, and just having those point people available can be really helpful and take off some of that stress in the moment.
Hi, thank you.
Mm-hmm.
Here's a really good question that I think this will benefit many. How do you stay optimistic when things haven't worked out before?
That is a really good question. And I think that's a challenging thing for caregivers especially, and the patient too, throughout the process. I think it's important to remember that post-transplant reality can look really, really different than your expectations. If you're struggling with, feeling anxious, depressed, or maybe doubting yourself, try to remember that everything you will go through or are going through as a caregiver is part of your new story, your new narrative. I really like to talk with caregivers about creating a new story that makes sense for now. And I also often talk with patients and caregivers about the new normal, which may be something that many of you have already heard about, either in literature or just in talking with social workers or other transplant professionals. With shifting priorities and for health-related reasons, really, caregivers and patients have to give up so many aspects of their old life. And parting with parts of your old life and your old habits can feel really unfair and frustrating. Caregivers feel resentful of all that's changed and all they've had to give up as they've stepped into the caregiver role. And something else I want to mention is that optimism can really look different at various junctures in your life. During your caregiving, optimism may look and feel different than it ever has before. You might be noticing smaller gains and accomplishments than you ever have before, and you might feel really prideful in accomplishing smaller tasks. So during your time as caregiver, I might, ask you to revisit daily goals and really remind yourself that you're doing the best that you can. And so you might have to adjust expectations and goals that you had in mind, make them smaller and more meaningful and attainable. And if you're finding it really difficult to be optimistic, I also want to remind you that it's okay to remember your resources. So mental health professionals are available and can support you through really hard times and give you the specific attention that you need when everyone else's attention might be on the patient.
Okay, some good tips, Olivia. I think another one here for how do you stay organized? My spouse has had 2 transplants, and I feel like I have papers everywhere from all over of his treatments, labs, etc. I have 3 binders full of info. Thanks.
That is a great question. I think, with caregiving, the state of your home is almost synonymous with the state of your mental health, and so you feel really frazzled, you feel really at a loss for how to contain the chaos and make things feel organized and attainable. And you mentioned that you do use binders. I often provide the suggestion that people use notebooks or separate binders to separate different areas of caregiving. So a medications binder, perhaps a treatment binder, a test results binder. I think any way that you can to really make the different aspects of caregiving easier, the better. I know that caregivers specifically, swear by their date books. They have everything written down in terms of appointments, what the kids need to be doing at any given time, and who plans to pick up that certain child and take them to that activity. I think it's really important to remember that you can use date books and other methods to keep yourself organized. And for those who are more computer savvy, I often tell my caregivers to use a Google Doc, which can easily be edited and reformatted, or even a Google Excel spreadsheet to keep things organized. And also, it's just easy to go in there, edit what you've done, or add things, add tabs, and that's all a paperless way of keeping organized. And I think, too, you can make notes on your refrigerator, in your car. Really make use of that notebook suggestion that I mentioned. I think it's really nearly impossible to keep details straight in your mind when you've got so much going on. And I know caregivers who literally walk around their house with their notebook, just making sure that they're not forgetting anything minute to minute. And that notebook really goes with them wherever they go and makes them feel confident, arms them with information when they need it. I just think it's a really great way to go about keeping organized and making sure you're tracking all of the important information that you'll need throughout the process.
Thank you. That's some good information. I have another question for you. We've had a few in regards to parents and how they're trying to cope and manage as they're trying to parent through this process. There's one two-part question that says, how can the patient go home when there are 2 school-age children and a school teacher at home? And then the second part of that question is, how can the children be told about a parent receiving a bone marrow transplant?
Those are 2 great questions, and I think managing kids in the home can be really challenging. The first part of the question, I think, how do you address infection risk concerns? And this is one that I'd really recommend that you discuss with the treatment team at the transplant center. I think they'd want to have an idea of what your home life will look like for the patient, if that's safe, and if it's not, provide suggestions on how to keep people separate within the home and really create an environment that is feasible and manageable for the patient and everyone else involved. I think too, they often provide gloves and masks for other family members who may be inside the home and who can't and don't have other options for lodging. And so if you're going to be among a big family and you've got kids and even a school teacher involved, I think gloves and masks are always recommended. And again, this is something that you should definitely visit with your transplant team prior to transplant, just so you feel like you can at least have a life when you go home and feel like it's manageable. And Jennifer, would you mind repeating the second portion of your question?
Oh, of course. The second part was, how can you talk to your child about you receiving a bone marrow transplant?
That's a great question, and one that many caregivers do have. I think what's interesting about this question is that there really is no right answer for any sort of situation or any particular family. I think it all depends on the communication styles that exist within that family and what's appropriate for the children in that family to know and understand. I think certain parents really pride themselves on being really transparent with their young children, letting them know exactly what's going on, that mommy is sick, she'll need to be in the hospital for almost 3 months, so that's all of this summer while you're in summer camp or playing with your friends. And then when she comes home, she'll be really tired and she'll need lots of help from whoever the designated caregiver is. And then there are some families who prefer to keep things really simplistic or even not really explore the transplant too much with their kids. And I think the important thing to remember is that you know your family's style best. You know how your family functions and what you've done in the past when bigger things have come up that the children have needed to be informed about. I think too the child family life specialist at the hospital will have some great ideas about how to really educate young children on the dynamics of the disease. It's really important to think through what you feel is important for your kids to know versus what is going to stress them out or cause distress within the family. And I think too it's important to remember that being a caregiver is a job, and being a parent at the same time is like taking on a second job. So you might have an infant or a young toddler, or maybe you have older school-aged kids who are involved in sports, school functions, maybe they play a musical instrument and they've got performances, maybe they've got parent-teacher conferences and there's really no pause button on their activities when you're needed as a caregiver or when the patient, who is typically the primary parent involved in all those activities, is too sick. And so this might mean you feel really stretched between meeting the needs of everyone, of your kids, of your loved one. And I think it's really important, and I tell my caregivers this a lot, to remember that even if they're the designated caregiver and they still need to fulfill responsibilities as a parent, that they should ask for help. So make sure they have someone to share the load with them, even if it's just occasionally. And sometimes I like to use, it's kind of funny, but I like to use an analogy called a peanut butter and jelly sandwich when I talk with my caregivers. So the caregiver is the peanut butter, and that caregiver really needs to stick to the job daily and provide the daily protein of attention to detail, and availability for emergency with kids and family decisions. And then whoever you designate as the backup, the friend, the family member, or the spouse, they're the jelly. They're the sweet reprieve. They give you a break, without which the sandwich would really be boring and dry. And so the jelly gives the caregiver a break when they need to really attend to other responsibilities. And then finally, I also just want to address this with this question. I think, many parent caregivers struggle with feeling like they're inadequate or feeling like they're a terrible parent and they're a terrible caregiver, and they feel really stretched thin. And this is a thing that many of you on the line may be going through, and I want you to know that you're not alone. This is something that I hear a lot, and something that a support group or even talking with a social worker at the transplant center can be talked through and managed.
Absolutely. It certainly does take a village, and I just appreciate everything you shared with us this evening, Olivia. You have been a wealth of information, and on behalf of the National Bone Marrow Transplant Link, we thank you for presenting this evening. We would also like to invite all of our callers to take our quick survey at the end of this webinar. This will enable us to help future caregivers and survivors. And of course, we thank you for taking the time to do that. We also want to make a special thanks to our esteemed link partners. They have made the work that you see or have experienced tonight possible. And again, thanks to our webinar event sponsors. And one last announcement to share with you before you leave the call this evening. We are excited to invite you to our future webinar, Tuesday, October 17th from 7 to 8:30 p.m. This webinar will focus on chronic graft versus host disease and will help patients better understand and manage chronic GVHD. Participants will learn about emerging and established chronic GVHD treatments, effective management, symptoms, and strategies to build resilience, emotional well-being, and we will have presenters Sandy Mitchell from the NIH. We will have Mary Flowers from Fred Hutchinson Cancer Research Center. I myself will be a part of that call with a transplant survivor, Meredith Cowden. And if you are interested in signing up, you can call us at 1-800-LINK, L-I-N-K, BMT, or you can call our 800 number, 800-546-5268. We hope to have you join us for our remainder in this series. Next week we have our financial series, and the last presentation will be dealing more with the emotional aspects and how to cope. And this concludes our presentation. We are grateful for your participation and hope you learned a new skill to help you as you cope as a caregiver. Good evening.
Thank you. This does conclude our conference for this evening. You may disconnect your lines at this time. Thank you for your participation and have a wonderful night.